We go. Good evening from my star in the galaxy. Good afternoon. My two guests are think back to back in LA. I'm going to introduce them in a minute. My name is Dr. Tovah Goldfine. This is TMS Roundtable, and we are live from Israel and LA. Guest tonight is Dr. David Schechter, his morning, and my co-host, Jeannie Kulwin. Jeannie and I always have a great time, and we secrete a lot of chemicals laughing. And tonight we're going to secrete some good chemicals with Dr. David Schechter. I introduced you this week. We were doing some social media this week, David, Dr. Schechter, and Dr. Clark, Dr. Schechter, Dr. Hanscom, Dr. Schechter, Dr. Feelgood. We did the PR we did this week was about solutions, and I kind of like Jeannie and I are finding, we're like, you're working very hard in your office in LA, and Jeannie and I are coaching and helping people and assisting people on social media and in our own practices. And, we're finding people that are just stuck, and they lose inspiration, they lose motivation, they lose their belief. And this is all chemical. So maybe we're here tonight to raise the bar a bit, give people hope and belief that their journey does not look like this, that it may look like this, but they're headed in that direction. And so I'm going to sit back and practice my listening skills and give it to you and Jeannie to start a discussion. And anyone in the Facebook feed is welcome to interject a question. At some point, we'll answer it. But what are you finding in your practice every day? And Jeannie also in how can we help people be consistent, be persistent, be patient with their healing journey.
Thank you for inviting me on again. Obviously, I've been on this before, and some of the people listening may already know me, but thank you. And I know some of you will be listening live. Some of you may be listening later on. I have the advantage of having gone back in this field all the way to working as a medical student with Dr. Sarno. So I kind of heard it from the mentor's mouth, the horse's mouth, however you want to say it, with respect to Dr. Sarno, and then have continued in my own practice and evolved my own approach over the decades. So when you are stuck, one of the things that I would say to a patient is, let's go back to the beginning. Let's go back to the basics. Do you accept this diagnosis? Do you accept the fact that you have neuroplastic symptoms? Do you accept the fact that you have TMS or neural circuit disorder? There's lots of names for this now, right? It gets a little confusing. PPD was the term du jour about a year or two ago. So do you accept this? And so this relates to evidence, but it also relates to your emotional feeling. And if you don't truly accept it completely or very close to completely, then what is it going to take for you to get to that level of acceptance? Because Dr. Sarno would emphasize to me that accepting the diagnosis was one of the keys to getting better. Now, in my books and in my clinical work, I do acknowledge that there are some people with a mixed picture where they have something physiologic or structural or chemical and a mind-body disorder, TMS, neuroplastic. And so those people have to work a little bit differently, because I'm asking you to accept that a significant component of your problem is mind-body, but not necessarily 100%. But for many of my patients, I am really taking them from a belief that their problem is structural and needs to be fixed by somebody, whether conventional or alternative, to the fixing is done inside of yourself. And you can use guides like myself, Dr. Tovah, Jeannie, others to help guide you through that process. But it's your healing journey that you have to really be prepared to go on. And the beginning of that healing journey is saying to yourself, am I ready to look at this in a very different way? Am I ready to do this work? So sometimes when you get stuck along the process, it means let's kind of think about where we were at the first step and if we've accepted that sufficiently. Jeannie, do you have any thoughts on that first comment that I'm making on acceptance?
Yeah, I think let's just validate that. I think having doubts is super normal, because I know people sometimes can put a lot of pressure on themselves too, because they don't fully accept. And so I think there's it's kind of on the spectrum, right? As long as they're willing, like you said, Dr. Schechter, as long as they're willing to do the work, as long as they're open. And I think, look, I had someone reach out to me, and she was already working with a therapist, right? And she was doing this deep work. And when she found out, she thought it was like manual therapy TMS. She didn't really know what was going on. And she just started crying on the phone because she just like didn't think she could do any more emotional work. She was also working with a therapist. So I think that's a really important piece, that this work isn't just deep diving for the sake of doing like, let's excavate your whole life and go into all your trauma. We don't even need to do that. We just need to understand your relationship with the pain and really check in on those emotions that have probably been pushed down. So I think when people hear that, like, oh, do the work, I think it's reassuring that you don't have to do all your trauma healing, and we don't have to get to the root of everything, so to speak. But we do need to explore the relationship with your emotions and how you think about the pain and your understanding of it. So I think people are kind of put off sometimes with like, oh my gosh, they're saying to do the work. I've got to undo, and really excavate like my whole life. And that's not true. So
some people have to do that. And I want to make this a couple shades of gray, because this is not black and white work. This is an art. And piggybacking on what Dr. Schechter said, you can have some doubts. You don't need to be 100%, but be aware of how the doubts are affecting your nervous system.
Yeah.
And be open to the possibilities. Be the placebo rather than nocebo. Be aware that you feel frustrated and angry and scared, and that's moving forward, because it's the awareness. Can you talk a little bit about, like, if someone has some doubts and how they progress forward?
No, I agree with Jeannie that doubt is normal. In fact, in my book, I discuss the fact that I believe that doubting you have this condition is part of the disorder. It's part of the condition. It's part of the personality. It's doubt. Having doubts is one of the 12 stages of healing I discuss as well in my book and in other resources. However, I believe that doubt must be addressed.
Yeah.
I don't think it's enough to just say, oh, I have doubt. It's okay to have doubt. It's normal to have doubt, but it has to be addressed. And, Dan Ratner does a great job discussing this.
Yep.
Crushing the doubt.
I think you probably had him on the show at some point. If not, you will.
Few times.
So Dan and I was on one of his early podcasts.
Right, recently you were together.
I'm sorry?
You were just together with him, with Dr. Clark, you and Dan. Was that you and Dan?
Doing what?
Doesn't matter. No, it
anyway,
doesn't matter.
We see each other regularly at board meetings of our nonprofit, but I don't think I've done anything recently with him. But in any event, on one of his early podcasts, he had me on because I was the only other person who'd really addressed doubt in the community. Dr. Sarno hadn't really gotten into that in his books. I talked about doubt, and then Dan has taken that further. So for those of you with doubt, I just want to point out there's 3 kinds of doubt, and Dan helped me to kind of codify this a little bit. So there's doubting that this condition exists. There's doubting that TMS or neuroplastic symptoms exist as a reality. Many people can get beyond that. There's doubting that you have neuroplastic symptoms, and that's one to struggle with, but it needs to be addressed, right? I mean, it's doubting you have it. Here's the third one that actually often gets people stuck. There's doubting that you can get rid of your neuroplastic symptoms. So you accept the existence of a mind-body disorder. You accept that you have a mind-body disorder. You accept that other people have gotten better from it because you read about it in books and videos and podcasts, but then you wonder or begin to doubt, can you get over it? So all of these doubts need to be addressed. They're addressed with your doctor, with your therapist, with your coach, and they're addressed in your own introspection, in your journaling. But it's important. It's normal to have doubt, but it does need to be addressed. And that's something that I'm constantly addressing with people at different levels, in person and virtually in the office.
I think Patty has a point. I know Patty's been in this community for a while. And her point is, of course, the doubt comes in when you're doing the work over and over and over again, and you don't see results. And so there's a big answer for that one.
The challenge there is the cause and effect. So is the doubt the result of doing the work and not getting relief? Or is the doubt the cause of doing the work and not getting the relief. And again, this is not an accusation, and this is not putting anyone down, because I'm sure that whoever is describing this is sincerely trying to do the work. But if you don't go back to stage one and say, what do I doubt and why do I doubt it? I mean, Alan Gordon points out, he's described an evidence sheet. You have to make a list of why you believe this diagnosis. Many of the coaches use this very effectively. I ask people very directly in the office, so what might be holding you back from accepting this? And they usually can give me reasons. Sometimes it's hard for them to access those reasons, and other times it isn't. One of the challenges is in the medical and alternative field, people are telling patients a lot of things, and it's truly remarkable how people who might forget what they had for breakfast yesterday remember what was said to them by a doctor, a chiropractor, an acupuncturist, somebody else 5 years ago. Yeah. And they can quote it verbatim. They don't remember what their wife wore.
It's the cellular network.
Exactly. It locks in, and unfortunately it becomes a nocebo. So a nocebo is obviously a message that you take in that's causing you to be worse, rather than a placebo where you take in some type of healing message, whether it's inert pills or whether it's just a calm presence, and it actually helps you to heal. So nocebos are very common. And again, no accusation here, but if you're doubting, think about whether it's cause or effect. Think about what the doubts are, address them. Sometimes, I've had people, including very prominent people, even prominent people in the TMS community, names, of course, will be confidential, not mentioned, who needed one more MRI to prove to them that it wasn't structural. Now, they already should have known that from their previous MRI or their previous whatever, but they were still struggling with the doubt. And sometimes I needed to get an MRI and look at it with them and explain the findings, explain the report, explain the images. So I'm just very particular in stuck people about looking at doubt.
I would like to just bring up something, a little hot topic, a spicy topic, and it's from the Alan Gordon work, which all of us have learned, and it's outstanding information. We know about condition response. We know about independent outcome. We know about that we cannot make our symptoms decreasing the goal, because of course what we want, that we resist, persist, type of thing, but however you say it. So the point I want to make is people are improving even without the symptom changing. They're improving in other ways. Their quality of life is changing, but for them, the symptom means everything. And that's not only a trigger for the brain, but it's not, the way out is not about you being out of pain. We all want to be out of pain. We all want to have less autoimmune symptoms. But when that becomes your goal, then it becomes a competitive nature between the conscious mind and the unconscious mind. So help me here to explain that we cannot make the symptoms decreasing our major goal. We have to understand the players.
Okay, well, I might take a slightly different tack on that, but if I was agreeing with you constantly, then we wouldn't have a very interesting discussion. So I think that unlike a lot of, and this is something that alludes to what Jeannie said early on, unlike a lot of, let's say, psychotherapy, where there seems to be no goal, you just talk about your feelings, you talk about what upsets you, etc. Goes on and on. I think Woody Allen's been in psychotherapy for 60 years. It doesn't seem to have really helped him, because I think he married a stepdaughter and did some other things that allegedly occurred that weren't so good. But anyway, so psychotherapy by itself doesn't necessarily fix people. I think it's good to have a goal. And one of the things that makes TMS, neuroplastic recovery therapy, more effective, because it has a goal. The goal is the relief of symptoms. What you're alluding to is that we can't become only obsessed with the outcome. That it's about getting into the process. You have to notice the outcome from time to time. You have to maybe give yourself a pat on the back when you're doing better, and you can give yourself sometimes a kick in the butt when you're not doing so well. But it doesn't mean only focusing on the outcome. But I think the goal of this is to get rid of symptoms, and that's the goal that I have. I just think that people do need to be patient and persistent, and that is challenging for many people with the personality types associated with this disorder, it's hard for them sometimes to be patient. It's not hard for them necessarily to be persistent, but you can burn out on something when you're not getting results. So now what Tovah said, I do agree with, is that it's not only the relief of symptoms, because I've had people who say to me, my pain's still 5 out of 10. Maybe it was 6 out of 10 when they started with me 2 months before. But when I find out that 2 months before they could only walk a block, and now they're walking 10 blocks. And when I found out 2 months before they were taking 6 Advil a day, and now they're taking 1 Advil a week, that indicates to me, yes, they are improving. It's just that pain has been the last thing to completely go away. They're getting their life back. As you said, quality of life. They're moving more. They're taking less medication. As you make pain less the focus of your life, you'll have less pain.
That's the point.
Yeah.
That's the point. Go ahead, Jeannie.
Yeah.
That's the point.
I was going to say something too, going back a little bit. Well, I love this. And maybe we can just, at some point, just like list off some actual concrete evidence that people are healing. Like to your point about, doing more activity, having less fear. Maybe they're sleeping a little bit better. Maybe they're laughing more, like you said, taking less medicine. I had a client the other day, she forgot to check in with me. She's like, oh, sorry, I'm living life. I'm like, that's the best thing. So we really want to, reiterate that there's so many, I think people are looking, Dr. Schechter, for the tangible evidence that they're healing if they're not seeing the symptom reduction. So.
Well, that's one of the reasons why, and I've mentioned this before, but this audience may not have heard it. One of the underrated elements of Dr. Sarno's contribution in this area is physical activity. He's known as the guru, right? Psychotherapy, Freudians, subconscious, all of that's part of his work, but physical activity. So he was the one saying to patients, and I watched him do it in the office 40 some odd years ago. I watched him say to patients, get up and move.
Yeah.
Don't let your husband push you.
Jump in 2 feet.
Literally. I mean, people came, and this sounds, ridiculous, but people came in being pushed by their husbands or wives in a wheelchair to his office because it was a long hallway from the parking lot, not because they were paralyzed. Obviously, he wasn't curing paralysis. And he would meet them in the office. The office was fairly small, so they might have had to walk 2 or 3 steps to get into the office. And I was in the office with them on another section watching. And after the consultation, they walked the 3 or 4 steps and they were going to go back to the wheelchair. And he walked out with them and he said to them, you're not taking that wheelchair back to your car. Your husband's going to push the wheelchair and you're going to walk next to him, or wife. I'm just picking an example. And that was the first step, right? So what I'm doing is not dealing typically with wheelchair patients, although I've had 1 or 2, but I'm telling people, how much can you do now? And they say, I only can walk 10 minutes. So I say, okay, I'll make this easy for you. Start with 6 minutes tomorrow and add a minute every 2 days. And in a month, they could be up to 20 or 30 minutes. So graduated physical activity is a great thing to get you focused on something other than pain that will help you heal your pain.
Yeah. I have another point I wanted to say, just because we're in the business, Tovah and I, of taking action. I want to really reiterate to people. So when we have a belief, right? Beliefs are often the same thought over and over, and neural pathways that have become really strong. So when people, going back to what we talked about with doubt, what can you say, Dr. Schechter, in terms of the neuroscience of, this is Alan Gordon with creating new pathways, right? I mean, if we've thought for 20 years that our knee is structural, that we can't heal and all this stuff, and then we introduce something and then there's doubt. Well, of course, because you've got 20 years of neural pathways of, experts telling you. So I think this really lands with my clients when I talk to them about the neuroscience of neural pathways. And even though this is your thought and maybe you don't have complete confidence, we can rewire these neural pathways and these thoughts to create more certainty and hope.
Yeah, we definitely learn a lot from repetition.
Mm-hmm.
I give examples to people of learning the piano, if that's something that they play, or tennis, if that's something that they've done in the past. You get better and better at your backhand or your piano playing with repetition over and over again, right? And after a while, it becomes effortless, and you have this pathway that you don't have to think. I mean, I may not knock on wood, even though I'm not a young guy. I made some catches yesterday in softball that were clearly neural pathways established somewhere between age 8 and age 20 that have persisted, because the ball came here and the glove came up and I caught it. And I didn't think. There was no thinking time allowed. It was just get the glove up and it stuck in there. So repetition. And that's why we say to people in coaching TMS recovery, neuroplastic symptoms is, fake it till you make it, right? I mean, it's sometimes you have to do things even before you totally believe it. Also, affirmations need to be repeated over and over again because there's a negative chatter in your head saying, I'm never going to get better. It's permanent. I've been damaged. And you got to replace that with a different type of chatter, which in a sense creates a new pathway in your brain, which is hopeful. I'm strong. I'm resilient. I've been doing affirmations with patients for a long time, and Alan Gordon includes them. I have them in my workbook. So I totally agree with what you're saying. I want to not skip over. There's a question here from Michelle.
I'm going to address it. Do you see it? Do you see it? I'm going to address her question right now. Do you see it?
I wanted to get to Michelle's question.
Okay. Do you want me to bring it up here?
No. There it is. That's very impressive technology, Tovah, that you could bring it up there.
Yes. 5-6 years later, finally.
So Michelle talks about hyperarousal. She talks about PTSD and, the fact that she has being completely stuck. So we could address some of those terms. First of all, what is hyperarousal? So hyperarousal to me is someone's nervous system is always on guard. It's always on go, right? It's hard for that person to let go, to relax, to breathe, to hit kind of a baseline that's calmer. Things like breathing exercises, meditation, and any kind of physical movement tend to help hyperarousal. And we try to avoid medication if we can. Occasionally, it's necessary in people in severe forms of that. So those are my thoughts on that. And I'll hear from the two of you in a moment. And then the other thing she mentioned is PTSD. So trauma is a key element in a certain percentage of people with this disorder. Dr. Clark emphasizes this in a couple of books of which I'm either a co-author or a contributor. We're called trauma informed books, right? So trauma informed approaches, and that's become a term that's very commonly used these days. So we have patients who do regular TMS therapy or coaching, but maybe they also see a trauma person, either a separate trauma person or a TMS trauma person that knows about EMDR and other trauma techniques to bring out some of that stuff. And that can be a very important part in pain recovery, is to address that PTSD or address that trauma. I think part of her question was, do I have to completely solve it or address all of it? Well, let's say you should address it. And with you and your therapist, I think you'll determine whether you have to address, quote, all of it or some of it. But if I had a festering wound on my arm, I wouldn't sort of like drain part of it and leave the rest of it in there to fester. I'd want to kind of get it all opened up to try to drain it. And I look at some of this emotional trauma as sort of the same thing. So I think we mentioned two things, hyperarousal and PTSD, and we can hear from our other panelists to see what they have to say.
I'd like to, I'm going to be a little tough love, and people can throw, eggs at me. But look, Dr. Clark will say you need to be a butterfly on the wall of your childhood. And that's where he'll go with that, with his very successful work. Dr. Hanscom will not go there with the trauma. The trauma was there. I mean, the trauma happened. You survived it. There was a threat. There's no threat now. So it's really about being in the moment and living in the moment and understanding, or what some people say, to integrate the past into the present. I mean, that works for a lot of people, and that helps them fly forward. Joe Dispenza, the trauma is not a place where, for some people, and I'm living in a country we're all PTSD. My tribe is all PTSD. It's about resilience. It's about patience. It's about understanding that child wasn't safe. And now you're an adult. And even Rose would say, put your big girl pants on. So my tough love approach sometimes is to integrate the emotions of that trauma, which are stopping you from healing, keeping your brain living in a threat mode. And that's where Hanscom will go into the threat safety work. And that's where people will help. And everyone with chronic pain most of us have medical trauma from the last 5 years because the doctor couldn't help you. And again, I'm not here to bash doctors. Doctors do the best they can. So I like to put trauma into perspective. And I will say that I'm actually signed up to do the EAET work. I was on a long waiting list.
Oh, you got on.
Yeah, I finally would do it. And I created a Zoom with this coach. We did EAET, which is expression awareness, emotional awareness expression therapy. And she simply brought the woman back to the place where she was rejected by her parents. The woman had to kind of rewrite the narrative of what happened. She was pissed at her parents. She answered the parents, and brought safety. Like, there's ways we can do this without living in what I call, the abyss. So my sense is to kind of look at each person individually and say, where do you want to go with this? How much do you want to stay in that past life? Do you want to move on? And that's one way that we can move with it, because people choose to stay in the past. I mean, I'm not talking about real PTSD. I'm talking about chronic pain, medical trauma. Recently, I even heard this, and it's rough. This is rough. I heard this in a workshop. God forbid somebody gets raped. They're ultimately responsible for what their life needs to be. I mean, like, they were a victim. But what happens in the future, what happens going forward, they have choices. What do you have to say about that?
Me or Jeannie?
Well, I think, oh, sorry.
Jeannie, go.
Yeah, I mean, I think, with trauma or TMS healing, in that sense of taking responsibility, that I agree with, right? Like, TMS is not your fault. Trauma, of course, is not your fault. But I would say, I think this is what you're saying, is it, but you, now that you know, have a responsibility to do this work. Yeah, that to stay in the victim mode. And that's why I loved how Dr. Schechter, we were talking about like the neuroscience and the neural pathways, because people will just simply say victim mode is like, I can't change my thoughts. I can't shake the doubt. And I'm like, no, neuroscience, it doesn't matter. Everyone can do this. So kind of, I kind of shared about my approach with trauma. I think when people have an immense, and I'm not, a trauma therapist, but I've certainly had great success with clients who have a lot of trauma. We get their chronic pain way, way, way down. And then guess what? After, they have more capacity and willingness to do the deep trauma work. But I just think personally, it's just too much to do deep trauma work. I had a client, 10 out of 10 fibromyalgia pain every day, 10 out of 10 crying every day. She wasn't in a place to do the deep trauma work. But guess what? Once we're still working together, but she, just on her own was like, I'm at a 1 out of 10. I can do the deeper, and she did. And I think a lot of people, but it gets to be an individual process, and everyone's different.
Well, that to me is the answer, actually, which is, you can speak in general terms, but I've treated over 4,500 individual consultations over the last 30 plus years. And so everyone needs an individualized approach. Mm-hmm. And so some people with PTSD need to, as you say, move on from it, keep living your life. Other people are stuck in it, are stuck in the PTSD, are stuck in the cycle. I mean, we see cases of people with PTSD, and we're unfortunately seeing this in Israel as well, of suicide. I mean, you can't say they didn't need more therapy. They obviously did, in my opinion, and needed something. And so help is going to be individualized. Some people need, as Jeannie said, some neuroplastic education, neuroscience education, and a system by which to move forward. Other people need calming of their nervous system from hyperarousal with more meditation, breathing, etc. And other people need to do the trauma work, because when it sits in there for long enough, it causes damage to you. And so it needs to come out. I think it just depends on the person. It's really an individualized approach. And you could try different orders. Like Jeannie said, in her case, she needed to get somebody down from 10 out of 10 pain to a point where they could later do the work. For some people, the first step is they have to do the work. For other people, it comes on later on during the process. And so that's what I think on that.
I'm going to answer these questions. I want to just chime in. And Michael Galinski contacted me 6 months ago, and he said, you have to have this guy on your broadcast. and it was a I have his book on my shelf. He had a huge trauma because his parents were in the Holocaust, and he had an enormous amount of anxiety and pain. He was on the broadcast. He wrote a book. He went through a very well directed mushroom trip with his therapist, and it was profound for him. It was profound for him, and I'm all about assistance with plant medicine or the right doctor, the right meditation, the right guru, whatever it takes. But for people to know that they're not stuck in the abyss, there's a way out. So I'm glad we all talked about that. Hi, Maria. Here's your question. I'm going to bring it up, and nice to meet you. I'm not familiar with you, but I'm glad you're here. Can you see it, Dr. Schechter?
Yeah. So this is an example of somebody with symptoms that move from symptom to symptom. And that's one of the different subtypes that we see of neuroplastic symptoms. For some people, it's just back pain for 25 years. For other people, it's headaches for 3 years, and then it's IBS, and then it's back pain, and then it's something else. So it keeps moving around. And with people who are moving around, I think that we do need to do the diagnostic evaluation and workup, but it's actually more confirmatory. It's more evidence to me of the diagnosis when it moves around, because it's not a fixed structural location or thing that maybe you're more worried something's going on in that area. And it started in her case, it started during a particularly stressful time. That was just the line right there. And that's a very important thing, to delve into what that stress was about and how it reactivated other things from childhood or from other times. And so, this person who's writing us ideally finds some practitioners to work with. It's hard to do it all yourself. I mean, it's possible, but it's hard. And but it's definitely, everything that's being said here, you can be diagnosed with a labral tear for shoulder pain. That doesn't mean that the labral tear is causing your shoulder pain, or that the labral tear can't clinically heal. The tear may not reconnect, but it clinically heals and becomes completely functional in the vast majority of people who are not professional baseball pitchers, which I presume you're not. Again, Lyme disease is common, but not everybody with Lyme disease gets symptoms, and many of them can be cured with antibiotics, etc. So symptoms moving around, starting with a stressful time. That's a couple of big check boxes right there in terms of having the diagnosis, although we're not diagnosing here on Facebook Live, but we are commenting on based on our experience.
Some advice that I might offer is just what I learned from the PRT work. The pain reprocessing workbook is a phenomenal workbook to go through with your pain coach. And a big thing that the two authors just had, horrible migraine headaches, among other things, and they've recovered. And what I love, the simple thing of sometimes asking whatever symptom is like, what is the symptom saying? And I know it sounds a little woo-woo, but your symptoms have a message. And again, underneath that message is usually a deeper feeling being repressed. And so you can look at that and step back and say, okay, the evidence is that the Lyme has healed, my tear has healed, I will heal. But what is my brain? Why is my brain still keeping me in threat mode? And I asked this question to Dr. Clark, and he said, obviously your nervous system still is recognizing that something has to be addressed. That was kind of like his answer. What do you think about that, Jeannie?
Yeah, I'm just kind of agreeing with all of that. I think just kind of looking like personally at this person, I think, I think there's always a reason. There's always a reason. Dr. Hamskanen said there's always a reason for what's going on. There's a reason why you have symptoms. So I think just as much, it sounds like Maria, I think I know Maria on Instagram. And just really focusing on solutions, right? Focusing on bringing healing, focusing on recovery. I know sometimes when people tell me they're stuck, something that could be helpful is that we focus on the problem. We focus on, getting more tests. We focus on like what's not working. We focus on how, all of us, right? If we just focus on for me, if I found TMS after 16 years, and if I just focused on, oh my God, it's 16 years, and oh my gosh, I was so young, and yeah, you get what you focus on. So I think maybe too, Maria, like you've got enough evidence. I mean, we can't certainly diagnose on a Facebook Live, but I mean, you've got 3 experts here who know that this is what's going on. I think sometimes the stuck is because we focus on the symptoms and the MRIs and what's not working and how long. And I would just encourage you, Maria, like focus on, yeah, healing, focus on your recovery, focus on joy and laughter and play and having a
compassion for how brave you are and how
yeah.
strong and sensitive. I mean, people that get TMS are strong and sensitive, brilliant people. This is a brilliant people disease, you know. And I think we answer, Lena. I think we answer your question.
Yeah,
He's having a problem with ruminating and not because there is this focus, like there's a spotlight on your symptom, and what brain wouldn't want to protect you?
And again, it's neuroplasticity. Oh, sorry.
What you pay attention to is what you'll get more of, unfortunately. So when you say, I can't stop thinking, start thinking of something else. Come up with a little mantra, an affirmation. You know, I'm strong, I'm healing, I'm getting better from this. And that really can counteract the rumination. You know, again, some people need other types of approaches, CBT, et cetera, for rumination. And other people rarely need medication to cut down rumination. But usually we can use these techniques to help stop ruminating.
What's behind the rumination? I mean, Lena, you're probably, you know, we're scared, we're angry, we have emotions, and that's what's driving, so we have to have enormous patience.
And get into your body too, Lena. Like the way to get out of the mind and the chitter chatter, because this is the mind body connection. And we forget that this body can support you. The thing is with mind body, in my case, and a lot of us, we're free to be in our body, right? That's where the pain is. Those are the emotions we haven't wanted to touch and feel. So getting into your body can be really challenging. It was so challenging for me, but that's a lot of what can help you.
What do you mean by getting into your body?
Oh, yeah. So like meditation with the breath, I do breath work, yoga. I mean, when you're playing sports, like you're in your body. That's why people love exercise. And that's probably why.
Right. I don't want them thinking about their body. I want them to be using their body.
Yeah. But like doing something, even stretching, because it's the body, and the mind will calm down when you get into your body. Yeah.
All right. Well, that's
Omer's question.
Good questions here.
Here's Omer's question. Nice to meet you, Omer. I've not met you before, but welcome to my safe virtual studio. Can you read his question, Dr. Schechter? Can you see it?
He said hemorrhoids before. I already read the question before, so I'm familiar with it. But he had hemorrhoids before for years, had surgeries. He feels that there's proof that it's TMS and muscle guarding, but there's an area that's tender to touch, and that causes doubt. So people often ask me, well, if this is tender, if I can reproduce this with this movement, therefore it must be structural or biochemical. And I say to them, no, this is a physical pain, a physical condition, but what's driving its persistence is the brain and the mind and the emotions, right? So it's not an imaginary thing that if you can touch it, therefore it's structural. It's a real process from the nervous system that we believe originates in the brain and the mind, and then it goes throughout the body. So I see people all the time who are tender here or tender there. As they get better, the tenderness goes down, but the getting better is not worrying about the tenderness. It's just saying, okay, well, that's where I'm at right now. And if I keep doing this work, and if I keep understanding where my stressors were at during my hemorrhoid surgery period or my current life, then I'll usually be able to get away from it.
Jennifer has a question. Jennifer, can you know something consciously and believe it, but it takes longer to get it to a subconscious belief?
Absolutely, in my opinion, absolutely. In fact, I talk about, in my stages of healing, I talk about people make that intellectual belief first, and that's helpful. Cognitive belief, intellectual, but you've got to get it down to the gut, visceral, emotional level to really, really believe something, right? There's different levels of belief. There's different levels of faith, if you will. But I'm not turning this necessarily into a spiritual or religious thing. I'm just saying that we can believe something kind of superficially, cognitively, but we have to believe in our gut. Most people will not marry or get engaged to somebody that they don't really feel it in their gut, even if somebody says, oh, they're perfect for you, right? So or you go, oh wow, that's an attractive person, but you have to feel something beyond that, beyond a cognitive or a thought belief. You have to feel something. And
that's what I say too, Dr. Schechter, about getting into your body. You have to get into the intuition. The intuition, who is this? This is Jennifer, hi, like your intuition, love, especially women. I'm going to say, Dr. Schechter, women have especially, right, Tovah, like amazing intuition. Your intuition, love, is in your body. That's where it is. Like even Dr. Schechter said, it's like a gut feeling. That's your body. And because we're disconnected, we live in our head, we live in the overthinking, we're disconnected to our intuition. So
that's well put. Yes. There's some men who have intuition too, but I think definitely women have a sensitivity that is
it's something we have to work on. It's a skill. It's something, and can we chat a little bit about this? Because how do we look? We have to feel our feelings. We have to be connected to our deeper feelings. Let's just chat for a few minutes about how some of us can know, because it's not like we're doing the right or wrong thing, but when we want to go deeper into our subconscious mind and know, look, the bridge from the subconscious to the conscious mind is where the healing will happen. How do we work on going deeper and to feel our feelings? Like, can we intellectualize that and talk about that for a few minutes?
People do it in different ways. I have found that journaling works for me and works for many of my patients very effectively. So it's not that first day or that first 5 minutes of writing that necessarily is going to give you your answer. It could be, I have a 30-day workbook. I have 2 of them now.
They're on my shelf.
It could be day 14, paragraph 2, where one question just hits you in a different way, and you start writing from a place that's much deeper and much more profound to you, and you can feel that connection to that writing. It's not just a forced thing. It's not just an intellectual thing. That's where you're really connecting to the subconscious. Some people do that in nature. They do that with walks in nature, where they just feel different. They just feel they're able to connect to things deeper. People often find it in the 48th minute of a 50-minute psychotherapy session, or maybe a 50-minute coaching session, where they've been talking to someone for a long time, just at a certain level, and then something clicks and they're talking deeper. The reason why I say 48th minute is because, of course, they tend to cut you off at the 50 minutes. But Jeannie probably gives you 2 or 3 more 4 minutes to get into it a little deeper.
I don't even look at the clock. How's that?
Yeah, I'm way over. I'm not.
You go over.
Can we talk about meditation, which it's not for gurus on the mountain. Meditation, mindfulness is a breath, is a pause. This is important. And Jeannie was doing a lot with meditation when I first met you. Yeah. But can we talk about the power of mindfulness and how scientific that is, and how we all have that at our breath deeply? We all can access that. Can we talk about that a little bit?
Well, I was going to say, just going back to the subconscious, just to make sure that people are aware that your subconscious mind is 95% and the conscious is only 5%. So I think that's really helpful. So if someone is struggling, and I know Jennifer asked about that, and I know even Sarno said, you have to do this all the time, repetition, because the conscious brain is only 5%. And let's face it, most of us are not woke 100% of the 5%. So we're operating less than the 5% because obviously we're not, Buddhist monks. So we've got to do a lot of repetition to get it into the subconscious. So I know you're laughing at that.
No, for you computer folks, it's kind of like the difference between your random access memory and your hard drive, right? I mean, you've got certain things circulating in your random access memory, but that's only a few gigabytes. And then you've got your hard drive where you've got a terabytes of stuff underneath. So it's kind of the difference between your conscious and your subconscious.
Right. What did you have to say?
And then I've heard before, Tovah, that the breath links this conscious and the subconscious. That's the link between the two. And again, going back to what I talk about the body, how do you get into a body that I was terrified of being in? I mean, I didn't know this, I didn't realize this, but that's why I was overthinking. I was terrified to feel any emotions. I was terrified. I had pain symptoms everywhere, changing, all this lack of control of my body. Why the F would I want to be in my body, right? That sounds horrible. So the breath is a great way to bring yourself slowly with safety into your body. And that's why I fell in love with breath work. Yeah, I was doing a lot more of it because it was a small way to, it's I'm operating here my whole life, overthinking, and then getting back into the body little by little with the breath or other tools.
And then you also asked about mindfulness, Tova, and people ask me about mindfulness a lot. But mindfulness is a very broad description of a process. I mean, to some degree, the work that we teach is a form of mindfulness, because we're saying to people, okay, you're noticing a symptom. Now I want you to be mindful of what your emotional state might be, or your emotional feelings. And I've had patients, this addresses something that you mentioned a little while ago. I've had patients who say to me that when they learn this work, and this is a strange thing for people to say, this is the first time they've ever really been able to identify their emotions. And now they can identify it from a symptom. Yeah. Right? Which doesn't mean you want to keep the symptom, but it means that you're learning how to connect to a deeper level. So there's different forms of mindfulness. Obviously, there's some of the mindfulness that's taught that derives from the East Asian traditions. You can be mindful just by picking up a smooth pebble, which I happen to have one here, and you can just feel it and touch it with your fingers, and it gives you a different sense of the world than thinking does. I'll put my smooth pebble back. But there's lots of different kinds of mindfulness, right? But I think that the neuroplastic recovery program teaches a form of mindfulness, a mindful awareness of emotional states.
That's a lot to unpack in that world. Patty, I'm going to bring up your question for Dr. Schechter.
What is FF?
Fight and flight, I think.
Yeah.
This issue of stories that people read or expectations that I'll get better in a certain amount of time. I mean, that was one of the main criticisms I heard of Dr. Sarno's otherwise excellent books for many years until I wrote my book. I was very conscious of including people that got better in 3 weeks, and also people that got better in 6 months or a year, or took a long time. Fran Anderson has been doing this work for many decades, and who worked with Dr. Sarno directly, also has many people who've had to work for long term to get better. So don't be either fooled or pressured by stories of people who get better in a day, or get better in a week, or get better in 3 weeks. It certainly happens, but it's not a competition. It can't be predicted. It's not based on how smart or nice you are or how hard you work. We're talking about neuroplasticity here. Jeannie has emphasized neuroscience, and neuroplasticity can take a while, right? Plasticity means the ability to change, but it doesn't mean we can flip a switch. And so one has to be patient and persistent, but also not necessarily consistent. By that, I mean, you have to reevaluate what you're doing. If something's not working for you, do something different. For some people, they say, "Oh, I've listened to every podcast. That's my treatment approach." Okay, well, if it's working for you, great. If it's not, maybe do some journaling. If you've journaled for a month and that hasn't had any effect, maybe you need to do some coaching or some therapy, or something else. So be persistent, but not necessarily consistent. And I think that's a good approach. Answers at least some of your question. I'm not sure.
I think it's very heartening. I don't know if that's the right word, but I had a broadcast once with two different people. One was a book cure, and one took longer. And what we discovered was it's personality. It depends on the personality. If you need to own who you are and love that. You need to love every part of you. I always say you need to even love the part of you you don't like. That's what the brain needs to hear, that it doesn't, it needs to be a brain and not be protecting you from yourself. And part of this, the one woman who, had a book cure after 30 years, this was her answer. And I find it very fascinating. She's a friend of mine here in Israel from New York. She's not a very emotional person, but she's she did not want to negotiate with her brain. It was like, brain, I get it. I get that you're protecting me. I don't want to have pain. I'm not going to negotiate with you. And she said, she began sitting when she wasn't sitting for 30 years. So part of it is like to make a decision. I say this again because there was a research study from a woman here in Israel. She interviewed 100 people who healed everything from chronic pain to MS to disease to arthritis to cancer. They're in recovery. And she wanted to discover what was the common denominator of what their recovery program was about. And you know what it was? And I don't mean to underestimate anybody, really, but they made a decision. I am going to recover. That's a chemical statement. That's the placebo. That's the law of attraction. That's the quantum, and I love to have your opinion on that, because I want people to, like even Dr. Schubiner will say, you can bully your brain if you're saying, all right, brain, enough. I got this, brain. You can be a brain. I'm going to recover. I don't need protection. Okay. Or he would say, provoke the brain. Come on, brain. Bring me the pain. I can handle it. So we have ways of standing up and saying, I will recover. And I think this is another mantra, affirmation, mindfulness, hope, belief, inspiration.
Look, for some people, a forceful approach like you're describing is very effective. This is why it has to be individualized. For that woman with hyperarousal, I would not tell her to start screaming at her brain and say, get better brain, because it's probably going to be counterproductive. For somebody else who is over intellectualizing but not hyperaroused, screaming at their brain may be exactly what their brain needs to hear. So you have to individualize it. It's a little bit of trial and error. I would say that after decades of doing this work, I'm very good at diagnosing TMS. I'm very good at predicting who's going to get better, but I can't predict how long that's going to take.
Yeah.
And I tell people, if I can't predict it, I don't think there's anybody that can predict it. So you can't predict it. You just have to go with the process, right? I mean, also sometimes it's based on the complexity of the issues involved. I had neuroplastic symptoms, and when I met Dr. Sarno in medical school, age 21.
Uh-oh.
No. Come back. And he had knee pain. Remember, he wanted to play basketball. I'll never forget. It was in the movie.
Yeah.
Dr. Schechter will be back in a minute. Wait a second. Okay, what were you saying?
One. Okay, now I'm back. What happened to Jeannie?
I want you to be in the middle.
I'm in the middle now.
OCD.
Okay. Thank you. Oh, we switched sides. That's kind of interesting. All right. Sorry about that. I don't know what happened. Anyway, I was saying I was a medical student, and I was 21 when I had neuroplastic symptoms. And, life is different at age 21 than it is at 41 or at 61. And so when I heard this exciting new information from Dr. Sarno and heard him present it and heard the logic of it, it was just like I was able to kind of go for it and get into it and improve very rapidly. But other than being kind of a worrier type T personality, I didn't really have major traumas that were causing this. I had, I guess, minor traumas that were stress of medical school and this sort of thing. And so everyone's different, right? I was at a particular point in my life where I could heal quickly. You can't predict. Some people are ready for change and some aren't. There's a whole literature in psychology about readiness for change. It tends to relate to things like quitting smoking and other bad habits. Good point. But the literature discusses the stages of change, and that you have, pre-contemplation, contemplation, action. It said there's like 5 stages of change. But the same thing applies to this work, which is not everybody's going to be in the same stage when they first are exposed to this. So we have to be a little bit patient with that as practitioners and as patients with symptoms, which is do the work, be persistent, change things when you need to, try different approaches, try different meetings with people, and coming to the session may be therapeutic for some people. You could have a book cure at age 41, and then I've had people come back 15 years later and not be able to get better with a book alone or something. They needed really to see a doctor and a treatment and all of that. So it just varies on the person.
Yeah.
Go ahead, Jeannie, do you want to piggyback?
Yeah, I would say, looking, at clients and who's going to do better. I do think all of this, the readiness for change, I love that. It's mindset, right? And if you're in this work of personal growth, knowing that you can get better at anything. And that's what a growth mindset is all about. And to Dr. Schechter's point, you can get better at anything. So better, even if you suck like I did at feeling my emotions and feelings, you can get better. You're not good at journaling or whatever it is, you can get better at anything. And this growth mindset is, I'm going to figure this out. So if a certain practitioner, it's not, you're not your coach or your therapist, it's not, things are not changing. If you're plateauing, it is okay to try something different or work with someone else or do a different program. And the point is like this mindset. It's like the same thing with entrepreneurship, right? I mean, I see it with people too. It's like, it's the same thing. You don't quit when things get hard, when you have a setback. And again, we allow ourselves to feel it. So we have a setback, or we allow ourselves to be angry or sad or frustrated. The same thing, we don't quit every time something's hard in entrepreneurship. We keep going. So I just want to emphasize that what I see with clients, and it's the same, as Dr. Schechter and Tovah, this readiness for change, it's a mindset. I'm not quitting. Like the only way I don't get better is if I quit. And that's kind of a mantra of help people. The only way I don't get better, the only way I don't heal everything is if I quit. And it's true.
Yeah, I see a follow-up question from Omer, so I'll just address it briefly because I had answered the question before. He says, I can't ease, and I hope you're still there, I can't leave the doubt that the surgeries messed something there. So I hear that from people regularly, and obviously sometimes you can be examined by another surgeon, and they can say to you and look you straight in the eye and go, nothing's damaged. Everything's healed. Either discussing with your own surgeon, this particular area of the body is hard to image, so there's not really good imaging to show anything. But yeah, sometimes the doctors can help you on this and just say there's nothing structurally wrong. So anyway, I just wanted to say that. I know you have Susan's question up there now.
Can you see the question, Dr. Schechter?
Yeah. Well, she asked whether sometimes the brain needs you to do the deep work to get better. She's had some success, but symptoms have changed to be more tolerable, which is good, but still concerning and still seem to her designed to make her address the underlying issues that sabotage me from a life of trauma. So that's a gut feeling you have that you need to go deeper. That I would trust that. I mean, I would trust that gut feeling, especially since you've made some progress, but haven't gotten to exactly where you need to be. Now you have to then take actions to address the trauma, which usually is with a therapist that has expertise in trauma. There might be other approaches that I'm not as familiar with, but I would say that makes sense to me.
No, I also want to make a point that, I love some of Alan Gordon's, his statements. I mean, we just have to trust this process. And in his book, he talks about, it's his basketball team from Philadelphia, in fact, and how do you remember that chapter? And this is not a basketball team. This is somebody's
team hasn't done so well in the last couple of years,
but anyway,
leave that part aside.
Anyway, and being from Philadelphia myself, so, sports there is a big thing. But I think what if we step back and take a look at our pain, fear cycle, our emotions, our body, mind, our neuroplastic brain, as it's our life journey. It's our tikkun, which means karma in Hebrew. It's our, our massage, our journey. And this is a journey. And if we look at it like that, we lighten up a bit. We kind of fold into it with like, wow, I can do this. I can live my life. And this is a biggie. We've not mentioned it tonight, but how about if we just take our symptoms and live our life? If we take our fear and do it anyway. If we take, like I take my anger to the gym. I go to sleep with my loneliness. I have, coffee with my sadness. And this is what keeps me from having symptoms, just personally. And I think all of us, the advice is live your life. That also teaches your brain. It also teaches yourself. It also helps your little child to come along and feel safe with you. And that's what most people will report to us. Well, I went and lived my life and I felt better. I still had pain, but I went and walked. So I think this is an important key of don't stop and wait till you get better.
Yeah, look, one of the early things I wrote, which is no longer available publicly, but it was, heal your pain and get on with your life. And so what you're saying is getting on with your life, living your life can be a key element of the process. It's not just heal your pain, okay, and then after that you get on with your life. It's more of like a continuous thing, which is healing your pain and getting on with your life is sort of part of what you do at the same time. You do small steps. So people will say to me, I want to spend the next 6 months fixing myself, and then I'm going to go back to work, or then I'm going to take a class. And I go, wait a second, part of fixing yourself could be sign up for the class. If you don't make it, you don't make it. But that's how you heal yourself, is to actually do the things you want to do when you don't have pain will lead to you having less pain if you start doing them. People lose that. I'm glad you said that.
I think this is going to answer Almaris. I love you, Almaris. You've been with me for like a long time. This is a beautiful Spanish man living, I think, somewhere in California. He's just relentless with his pain. He had surgery. Okay, now he had surgery. Now what? Bring it on.
Well, he had surgery on the right side, and I think he said it did well, right? And then now the left knee needs to be replaced. I got to go through this again. I did well with my right hip, and now I got to go through this again. Look, osteoarthritis of the hip is a real disorder, and there are people who tremendously benefit from surgery. I don't advise that everybody with pain in their hip do neuroplastic treatment. There's people who really do benefit from what you did. So that doesn't mean your back pain or your headaches or your stomach pain might not be a neuroplastic, but it could be that your hip is a structural arthritic problem. Maybe that's good to have that on the show, just to say that we're not telling everybody all the time that you fix yourself psychologically, because I don't believe that, and Dr. Sarno didn't believe that.
Okay, but to go into surgery with a mindset of, because lots of surgeries are not successful, but to go into surgery, like Schechter, Hanskimball has a big thing on his website about what to do going into surgery. So, and Almaris is a mind body, sensitive man who's
No, there's a doctor in San Diego who does pre-surgery hypnosis the day before and gets people into a positive mindset. He wrote a book. I'm blanking on his name right now, but you might be able to find it if you search hypnosis, San Diego surgery, whatever. Or if you email me, I could probably find the name for you. But I've actually done a little bit of, I don't know formal hypnosis, but I've kind of done some meetings with people the day before surgery to see if we could give them some calmness and some good space, just kind of a conversational sort of calming approach. I think you definitely, if you ever need surgery, and Hanscom emphasizes this in his books, and I totally agree with him, if you ever truly need surgery, it's important to be in the right emotional state. If he operates on somebody in fight and flight, or he operates on somebody who has not processed their traumas, he finds the results are not as good. So not a shock there, but it's like, nobody really focuses on that, is getting the person ready in the right state of mind to have a procedure like that.
I have a question for the two of you. And it brought up two thoughts. One is, how do people walk on hot coals? Tony Robbins. And number two, what about the people in foreign countries that do psychic surgery, where they go into this hypnosis state and then they open you up without anesthesia? Like, let's talk about the power of that.
You believe that psychic surgery is real, or it's a fake? It's a fake.
No, what I do believe is that we all have a relationship with pain, just like the guy with the nail in the boot, or the guy with the nail in his. We have a relationship with pain because of our childhood, because of our past lives, and we have to look at who we are with pain. And some of us will be able to walk on hot coals, and have their head somewhere else and walk on hot coals because it's happening. And some of us will be focusing on the hot coals and burn our feet. And I think we have to know, that's my feeling, we have to know who we are and what the dance is. What do you guys think about that?
I do not know about that, actually. I did the Tony Robbins training from my house, so we didn't have to do the hot coals. So I don't know.
You'll have to invite a hot coal walker on the show for that. I had something I don't know if we have how many more minutes we have, but I had something that I wanted to briefly bring up. Perhaps. Please. Okay, you mentioned EAET, you mentioned PRT. Let's just briefly go over these things. I actually had a recent email exchange with Mark Lumley, which was very enjoyable. I look forward to, seeing him at the next conference. We know of each other by name, but had not had any interaction before. Obviously, he's worked with Howard Schubiner for many years. So, first of all, there was psychotherapy in this field before Alan Gordon came up with the PRT approach. He actually came up with it in part when he was working in my office, because he doesn't really acknowledge or mention it in his books, but he worked in my office before he got his own practice.
I didn't know that.
I didn't know that either.
Very few people know it. It does not come up in his books for some reason or another, but that's fine. Maybe somebody writes a biography one day, they'll mention that. But anyway, he found that that he could get faster results working on the safety approach than in sort of some of the traditional TMS models of therapy. But if you actually watch the Pain Brain film, which I hope both of you have, it's a good movie. It's accessible on its website. If you watch what he's doing, it's not just PRT. It's good therapy, right? Mm-hmm. I mean, think of it. Watch it again. Picture it in your mind. Okay, so PRT is a skill. PRT is a beginning for people. it's not necessarily the be all and end all. And I have so many patients who've done 6 sessions of PRT with a young therapist at a psychology center, which I won't mention the name of. And then they go, what should I do now? She doesn't seem to have the skills to go deeper. I go, well, you need to go deeper.
Yeah.
Okay. And we discuss how they might be able to do that. EAET, which was developed as a protocol by Lumley and Schubiner, emotional awareness expression therapy. I feel like that more accurately reflects the therapy that Dr. Sarno and Arlene Feinblatt developed together 50 years ago, and that they passed on to Fran Anderson and Eric Sherman and others, and that I witnessed at the Rusk Institute decades and decades ago. And if you think about the journaling that I do, it's expressive writing, right? It's emotional expressive writing. So EAET is perhaps a deeper method or technique than PRT. And when I asked Mark Lumley about EAT recently, he said, yeah, we've borrowed from a lot of different things, just like everyone else has. It's not like it came de novo from nowhere. I mean, there's a lot of different elements to it. ISTDP has elements in there, and even CBT, the thing that everybody talks down on in this world, there's elements of that. So good therapy, like all of these approaches, good coaching is individualized. Jeannie doesn't do the exact same thing with everybody. She's very good at her work, and she meets the person, finds out where they're at, and helps to take them along their healing journey. I don't take the same approach with everybody. Tovah doesn't, and good therapists, psychotherapists don't do that as well. But I just thought it's interesting for people to hear. I know you're thinking of taking an EAT course. You'll be able to talk on this on this podcast after you take the course about what you learned. And again, these courses are designed typically for people with some therapy skills or coaching skills, and then, of course, to augment that. But I just don't want people to feel that any one approach that's been written about is the be all and end all. It's the therapist or the coach using these skills and drawing on elements of these skills and knowledge that I think helps the patient to get better, working with that individual person in an individualized way, not some cookbook approach that may be designed to do it to be useful in a research study or a protocol, but is not comprehensive by itself. So I wondered if you have any thoughts on that.
Well, I just like to say that I think what's amazing about our profession, and I also felt this as a chiropractor, and I still do, that we treat the patient, not the symptom. We treat you, and this is very important. And again, medical doctors are amazing, but they do sometimes cookbook you, and they do the best they can because that's what they do. And we need the medical model. But I know in our work, we're really looking at you individual, and there's never two patients alike. And I really think that's, a testimony to our work, and we do the best we can. And sometimes it's a combination of coaches, and that's beautiful. I love that we work together and try to co-pilot with people. What do you say, Jeannie?
Yeah, I couldn't agree more. I think you guys both know my boyfriend is a therapist, and he says, and I've said, like he said, and I know it's the same with coaches, like 50% of your recovery and your success in either is like your relationship. And there's so much healing that comes from the trust with your coach or your therapist. And, especially with therapy, it's kind of like reparenting. Sometimes he talks about like reparenting, like the parent they never had. And for coaching, it's like just that chutzpah and that confidence and that hope that I really bring, to kind of like the table, that people come to me like if you feel stuck and then you need to work with someone who doesn't feel that you're stuck. You need to work with someone who, Nicole Sachs says, I love what she says. She's like, borrow my confidence. And that's what, you're getting. And so I think like that's so important, Dr. Schechter. It's not the tool specifically, it's the message behind it, how you do it, but it's really that resiliency and someone's not going to let you fall.
The relationship is extremely important. We should put a plug in for Lowell Weiner because he's a good therapist, and you mentioned him briefly. Yeah. We've mentioned a lot of other people on the show today, or the Facebook Live, and I mean that's.
Listen, this conversation needs to continue. We're past our time, and but I really love this conversation. I was thinking today, because that we say sometimes the same thing every week, but we say it with a flavor and an inspiration, and because there's nothing new under the sun. And we're simply saying to you, we're repeating and repeating and repeating, and that's exactly what you need to do, because there's nothing new we're going to bring you. We're going to bring you from our point of view. We're going to bring a new guest. Jeannie and I are going to maybe say something a little different. Maybe I'm going to wear something different. But the point is, it's like we are here to just keep inspiring you that this is the way out. That if we trust this process, you will recover. And if we have to meet each week, because I'm not going anywhere, I'm going to do this for the rest of my life. I'm going to 120. Jeannie's going to be with me. We're going to have Dr. David Schechter on the show again and again and again. The point is, we're not saying anything so different, but maybe there's something in our broadcast tonight that will, drop some pixie dust onto your sweet soul. But just don't give up. The belief is important. The hope is chemical. You are the doctor. I mean, we're really, in Hebrew, we call it, we're the messengers. We're the shaliachs. We're just here to bring you the message, but you are the pilot, the conductor. What do you want to leave some words of inspiration to say good night, Dr. David and Jeannie?
Well, I'm saying good night to some, and I'm saying good afternoon to others, and good evening to some in between. But that's the exciting thing about the worldwide TMS roundtable approach that Tovah pioneered with her colleague in Australia, who unfortunately is no longer with us. But the worldwide approach, I mean, this is truly a global diagnosis, global phenomenon of people becoming more aware of this. I sometimes say we have a national nonprofit, but really our nonprofit is global because we have members from all over the world. And these books are read all over the world. I mean, I can tell from my people downloading Kindles and things from different countries, usually the Anglo countries, because my books are written in English. But I have a book in Dutch, been translated into Dutch. My book and workbook have been translated, and I get a report every 3 months from the Dutch publishers that people are reading it in Holland. So it's spreading around the world. Dr. Sarno's books were translated into at least 10 or 15 languages, Korean and other things.
I think up to 20, 25.
Yeah. So it's a worldwide phenomenon. It's just it doesn't mean that it's easy. It doesn't mean that it's a checklist. It doesn't mean that it's a checkbox. It's human beings struggling to get healthier, to get more mentally aware, to get more mindful, and to feel better. And it's we're humans. We're all struggling together. That's why hopefully the person you work with, if it's a therapist or coach, you relate to one another, because many of us have been through our own symptoms, as I have, and Jeannie has, and Tovah, I believe, has as well. And we're humans, so we know what you're going through day to day, week to week. We don't all have the same experiences, but we can hopefully empathize with your experiences and help you to see things in a clearer way. So I'll just leave you with that, and have a good rest of your week, regardless of what time today is for you. And good day or good night.
And we have to plug over that we're going to be back next on this
in a couple of days.
In a couple days.
Not with me. Not with you.
No, I'm working overtime this week. But Jeannie, go ahead. Say a few words to Omer in China. He's really upset that there's no books in Chinese, but it's okay, Omer. You're speaking good English.
Yeah. I mean, I just like it's already been said, Tovah has said, we are just the guides. And that's what really psychs me up like no other about this work, is because I was giving all my power to the acupuncturist, to the healer, to the Reiki person, the I can't do chiropractor on my own back. Like, I was giving all my power away. And I just love this work because we don't pretend to be gurus fixing you. We're just the messenger. We're just the guide, and it's all your power. And that's why once, as Dr. Schechter said, once you start to realize how much power you have and you're in charge and your own healing capabilities, other things in your life start to manifest, and you grow in relationships and change careers and have more just life gets bigger and bigger. So I just really want to emphasize that, it's our self-healing power. It's already within us.
Very important. Very important. You are the doctor. So we'll be back on Thursday with another guest this week, but then every week we're here, and you'll see Jeannie again. We have some great shows coming up in the future. But I want to say that this will be uploaded tonight or tomorrow. If you have any questions for Jeannie or me or Dr. Schechter, Dr. Schechter is on Facebook. He's now on Instagram a lot
Yeah.
more than he was. And Dr. Schechter's books are amazing. His Mind Body Journal is phenomenal and can be done by. He has a book that's for children, for teenagers, and so if you need us in any way possible, we're around, we're available, and thank you so much. I love to see my studio full. Thank you for coming to the Facebook page. You guys have a wonderful day. I just, from my heart and home, I'm just so blessed to be rubbing shoulders with people like you. Really, really humble little me. So till we meet again, have a wonderful day. God bless.
Bye.
Okay, here we go.